Choosing a nursing specialty can be an exciting yet overwhelming task. One of the awesome things about nursing is that as a nurse, there are countless specialties to choose from based on your interests and strengths. However, this abundance of choice can make it nerve wracking to pick the right one. In this video, I'm going to give you some food for thought to help you choose the nursing specialty that's right for you. If nothing else, by the end of this, I hope to help you either narrow down your choices or at least point you in the right direction. Let's go over a few quick house cleaning things before we get started. First, if you're looking for nursing jobs, you can check out the nursing job board at nursemoneytalk.com/jobs. My second quick point is that you don't have to feel stuck with the first specialty you choose. Nursing offers a lot of options and you can always switch if you find that your initial choice isn't quite working out, or you get tired of that particular specialty after a while. You don't need to feel like you're married to your first specialty because you're not. My last quick point is that it's perfectly fine if you don't know what specialty you want to pursue. Some nursing students come into nursing school knowing exactly what they want, like becoming a CRNA or working in pediatrics, while others figure it out during their clinical rotations. And for those who complete nursing school without a clear career path in mind, med-surg nursing can be a great starting point. This is due to the exposure to a variety of disease processes in med-surg. Now, let's actually get to the main part of this video, which is helping you navigate and figure out which specialty is going to be right for you. When you think about the right nursing specialty to start with, something you really need to do is to take a deep dive into your preferences, interests, and non-negotiables. By identifying these factors, you can look for nursing specialties that fit within that framework you've established or that check enough of those boxes to move in that direction, even if it ends up not being long-term. Here are some points of consideration. One example to consider is whether you even want to deal with patients. This might seem like a strange question, but it's a legitimate one. There are nursing jobs where you have minimal direct contact with patients, yet you still use your nursing education. For example, you could consider becoming a nurse case manager. In this role, you coordinate care for patients, often over the phone or via email rather than in person. Another option is utilization review, where you assess the necessity and efficiency of the healthcare services, typically in an office setting. Nursing informatics is another field to explore, where you work with healthcare data and technology to improve patient care without much direct patient contact. Now, of course, if you want direct patient contact, then the jobs I just mentioned might not actually be the best options for you. Something else to think about is the kind of schedule you want. Maybe it's important for you to have a 9 to 5 job. Maybe you prefer 12-hour or 16-hour shifts. Maybe you want the option to work nights, or maybe you want to avoid certain shifts altogether. For example, most inpatient nursing jobs involve 12-hour shifts, and since hospitals are open during holidays, you'll likely be required to work some holiday hours. Night shift might also be part of that deal. If you prefer a more traditional Monday to Friday 8 to 5 schedule, then make sure to look into clinic or specialty clinic jobs. For instance, when I worked in GI as an endoscopy nurse, it was a Monday to Friday job, typically 8 to 4, with no holidays or weekends. However, that job did involve being on call occasionally with a rotating call schedule. Another consideration is whether there's a specific patient population you prefer. Many new nurses quickly decide if they want to work with adults only, pediatrics only, or a mix of both. In hospital settings, specialties are often divided between adult and pediatric units. In some cases, you might float between the different specialty units in a large hospital. Additionally, consider if you want to work with geriatrics, focusing on older adults. This often involves settings like nursing homes or assisted living facilities. Next is to think about whether there's a specific disease process that interests you more than others, or maybe there's one that you definitely don't want to deal with. For example, if you're interested in heart-related conditions, then maybe consider working in a cath lab, cardiac ICU, or cardiac step-down unit. If mental health fascinates you, consider working in an inpatient or outpatient mental health unit. Alternatively, consider if you have a strong interest in other specialty fields like women's health, maybe OB related, or possibly urology, just to name a few. Next thing is you want to consider the pace at which you want to work. Do you want a fast-paced environment where you're constantly moving? If so, maybe emergency room nursing or endoscopy clinic might be a good fit. These settings involve rapid patient turnover and constant activity. Conversely, if you prefer a slower pace where you can take your time and really think through your actions, look for specialties that offer that environment. Now, this next point is similar to the pace of work, but also different. Do you want a high stress or low stress job? You might have a nursing job where the pace is slower, but the stress level is high because your decisions carry significant weight, possibly involving life and death situations. For example, working in an ICU, particularly in like a post-transplant recovery, involves high stress decision making. Conversely, you might work in a faster paced environment that is what I would consider lower stress. For instance, when I worked in endoscopy nursing, it was very fast paced. We prepped the patients, assisted with procedures, and quickly turned over rooms for the next patient. Most procedures that we did, such as colonoscopies or EGDs, went according to plan, making it less stressful despite the fact that it was a very fast-paced environment. The next thing you want to consider if there's aspects of patient care that make you squeamish. For example, does blood make you uncomfortable? Or perhaps you find sputum or fecal material particularly off-putting? If so, be aware that many direct inpatient care positions will involve dealing with these substances. If you're certain you want to avoid specific bodily fluids or types of care, this can help narrow down your specialty options. Something else to ask yourself is, how much do you want to make? Many aspiring nurses don't want to think about this and will say it's all about helping people. While I do think you have to be about helping people, that doesn't mean you need to forget that healthcare is a business and we live in a capitalistic society where you need to make money to be able to take care of yourself and your loved ones. With that said, certain nursing specialties can be more lucrative than others, especially depending on the demand where you live. If this is important to you, and there is absolutely nothing wrong with it if it is, ask around to more seasoned nurses or check on sites like PayScale or Salary.com to get an idea of salary ranges for different specialties. I've talked about various questions you can ask yourself regarding patient populations, certain shifts you might prefer, and disease processes. As you figure out your interests and priorities, remember that each point doesn't exist in a vacuum. What I mean is you can mix and match your preferences to figure out what specialty works best for you. For example, maybe you only want to deal with adults, but you want to work Monday through Friday, banker's hours, you don't want to work holidays or weekends. In that case, endoscopy nursing might be a specialty to consider. Alternatively, if you prefer working with children but want a similar schedule, maybe consider an endoscopy clinic that performs GI procedures on kids. The key is to identify your preferences and then find specialties that match those interests as closely as possible. From my personal experience, you're not stuck with whichever option you choose first. I've worked in various specialties ranging from transplant ICU, mental health, and nursing leadership, just to name a few. This variety has allowed me to explore different aspects of nursing and find what truly interests me. Get started today and go to nursemoneytalk.com/jobs to start looking for nursing jobs.